find yourself sniffling and sneezing a little bit more now that the cold weather has settled in, it might not be a seasonal cold, it could be seasonal allergies. Ed Neuzil, board-certified registered nurse practitioner at Allergy, Sinus and Asthma Family Health Center, reminds us that allergy season in Florida is year-round.
Well, allergy season here in Florida, as I'm in the allergy, sinus, and asthma business, is very good because it lasts from January 1st to December 31st. There is really no time of year that there may not be something that you could be allergic to. Other individuals have some trees, maybe some grasses, then they've got some weeds, the old hay fever, then the molds, the cat, the dog. And for those individuals, there's not a time that they don't have something that could trigger it. Those are the individuals that really should look at seeing their provider, maybe getting some allergy testing, even considering immunotherapy, because those are the individuals that would benefit the most. When we looked at colds, if this happens every time this time of year, then it's probably not a cold. It's something that should be looked at as a possible allergy. When should I go ahead and see a provider for this? It's when it's no longer controlled by you with minimal amount of medication. For people that have more of a persistent symptoms for allergens, and we do check and we test for allergen triggers, the serum that we make up is specific for those individuals. They have their own vials, and this is actually a titration of everything they're allergic to. It's the actual pollens and stuff that's mixed up, is generally injected under the skin, and it's given on an increasing basis. So depending upon your severity, these injections will be given, and each time you would come in, you get a little bit more allergen until you got to what they call a maintenance level. And this is a level which was figured for you that's going to most benefit you without actually triggering symptoms. When we're giving allergy injections, I tell the patients that you shouldn't even feel any difference after the injection. If you're starting to notice nasal symptoms, any itching to the skin, any allergy reaction, it may be one of two things. That it was either started too strong or we're advancing you too rapidly, and then we make adjustments accordingly. When we talk about prevention, there's various things that you can do, taking a shower and rinsing your hair and rinsing your eyes, and then also rinsing your nose, because as you breathe in, the nose is a filter. If you plug the filter, it doesn't work. Then when people start to breathe in through their mouth because their nose is plugged up, now they're taking all the dirt, all the pollen straight into the lungs, and then you have a greater chance of having asthma symptoms or even developing something called bronchitis.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus and Asthma Family Health Center, just click the Year-Round Allergies tab on our homepage, yourhometownhealth.com.